Hi, and welcome to Sentinel U. My name is Laura Gonzalez, and I am the VP of Clinical Learning Resources for Sentinel U. We are the leading healthcare simulation and innovation simulation company. We develop content for nurses, pre-licensure, post-licensure, social work, health education. We really feel that we are a product that will help you fill that clinical gap, if you will, allow your students to participate in online immersive environments that are going to help them with their prioritization of care, their patient management and delegation skills. And the one thing I'd like to point out today is our telehealth product. So this product is unique in that the learner is going to encounter the patient in the inpatient setting. So it could be a patient, perhaps a postpartum mom, or maybe it is a patient who's been struggling with a mental health issue, such as depression. It could be a patient with a chronic illness like obstructive lung disease, or diabetes, if you will, like this particular one in case. So you meet this patient in the hospital setting, and the nurse will have to identify what peripherals she will need in order to have this home visit. She will educate the patient on what is going to be required of this home visit. And along the way, one of our goals is that she is also gaining the telehealth competencies, which is really important when you're doing a telehealth visit. And in this particular screen, you're seeing the actual nurse interacting with the patient, and you can see that they have some peripherals here along the left. And the nurse is also required to understand, what would I do with these peripherals? And in this particular case, this gentleman is a diabetic, and he's having some complications, and you could tell that his sugar is significantly elevated at 240. So she's going to do some troubleshooting with him in this environment, and she's going to make some decisions. She's going to make some recommendations for care, right? And then they're going to work through this, and then she's going to, again, follow up with him and ask him if he has any ongoing questions, and then she'll close the encounter. So this is a really interesting, I think nowadays when we're seeing so many patients being evaluated and seen in the telehealth environment, this is a really unique way to kind of get those competencies, if you will, right? So this is our telehealth series. We have other products. One of the other products that were very popular is our prioritization of care product. The Prioritization of Care Specialty Series has a whole portfolio of content that allows the faculty member to kind of enhance their curriculum. They can choose from geriatric, pediatric, maternal child health, right? And so the learner enters into this environment where they have to choose, where does the patient go? The patient can either be an inpatient or an outpatient. They can go to critical care or to medical surgical unit. And during that, they have to prioritize, who am I going to see first, based on the clinical cues and information that's provided. Once the nurse, the learner, has gone through the content, she's making some high-level decisions, right? She's really critically thinking. And then at that point, she's going to organize her patient care, and then she's going to decide what interventions they require. So not only are they providing interventions, but the rationale, and they're getting immediate feedback. And of course, this is all evidence-based. So this will take a learner anywhere from like 3 to 5 hours to work through this content. And they're getting feedback, and then they get a score that they can share with their faculty, and they could work on some debriefing practices.